Hello guys, today's topic is oral pigmentation. What is oral pigmentation? Pigmentation means coloring. So pigmentation, it is defined as deposition of pigments in the tissues or in the oral mucosa. What are the causes of the pigmentation? The pigmentation can be due to the augmentation of the melanin production, increase in the number of the melanocytes, or deposition of accidentally introduced exogenous materials. Coming to the classification of pigmentation, they can be classified into endogenous pigmentation, focal melanocytic pigmentation, multifocal diffuse pigmentation, melanosis associated with systemic or genetic disease, idiopathic pigmentation, or treatment of mucocutaneous melanosis, depigmentation, hemoglobin and iron associated pigmentation, or the exogenous pigmentation. First comes the endogenous pigmentation. The endogenous pigmentation, they are characterized as hematogenous or non-hematogenous. Hematogenous pigments that originate from the blood, whereas the non-hematogenous pigment that originates from the non-blood, that is fat or fat-like or non-fat-like substance. The example of endogenous pigmentation they are found in the liver are the hemosiderin and the bilirubin. So there are two types of pigmentation. One is the exogenous pigmentation and other is the endogenous pigmentation. The exogenous pigmentation, pigments or minerals having origin outside the tissue, whereas the endogenous pigmentation, the pigmentation that are found in the body. So these pigmentation may be due to the hemoglobin that imparts blue, red or purple color seen in disease are the varix, hemangioma, Kaposi sarcoma, angiosarcoma, hereditary hemorrhagic telangiectasia. Hemosiderin, the color is brown. The disease may be ecchymosis, petechiae, mucocele hemochromatosis. The melanin pigment that impart brown, black or grey color, that is associated with the disease melanotic macule, nevus, melanoma. So the first is the endogenous pigment. They originate from the blood. They could be either melanin pigmentation. So melas, that word means black. So it means the pigmentation associated with will be of color black. It is composed of brown black pigment that is composed of eumelin and pheomelin that has red yellow in color. So as we know that melanin, it is a derivative of tyrosine and it is synthesized by melanocytes which typically resides in the basal layer of the epithelium. So that can be either physiological, pathological, multifocal or diffuse in presentation. The first are the freckles. These are the result of the overproduction of the melanin. So melanin is a pigment that gives your hair, skin, eyes its color. So this melanin, it is produced by skin cells called melanocytes. So this freckle is commonly occurring asymptomatic brown, tan or brown shaped macule that is often seen in sun exposed region of the facial and perioral tissues. The freckle, it tends to be darker during the period of prolonged sun exposure and less during the winter and autumn month. FLEs, they are most commonly seen in light skinned individuals and are quite prevalent in the red or light blonde hair individuals. So with the increased age, the number of these FLEs and color intensity tends to diminish. So in general, no therapeutic intervention is required. Oral labial melanotic macule. The melanotic macule is a unique benign pigmentation lesion that has no dermal counterpart. It is the most common oral lesion of melanocytic origin. So the melanotic macule, they can arise from the three different sources. One is the intraoral freckle, post-inflammatory pigmentation or disorders like Addison disease, Peutz-Jeghers syndrome. So the melanotic macule, it is also known as focal melanosis. What are the clinical features? It is seen more frequently in the females, usually seen in the lower lip and gingiva region. The lesion develops at any age, but it tends to be more common in the adulthood. So these lesions These are small, well circumscribed, oval or irregular in outline. Pathology: it is characterized by a normal epithelial layer. The basal cells contains abundance of the melanin pigment without an increase in the number of melanocytes. Other is the oral melanocanthoma. It is benign melanotic lesion. The lesion is reactive in nature. So this is oral melanocanthoma. It usually present as rapidly enlargement, ill-defined, dark pigmentation. It occurs mostly in the black females in third to fourth decade of life. Typically, they are asymptomatic. Buccal mucosa is the most common site of the occurrence. Borders, they are most commonly irregular. Next is the melanocytic nevus. It arises as consequence of melanocytic growth and proliferation. The intramucosal nevus, it is the most common and most frequently observed. The lesions, Nevus cells, they are cytologically and biologically distinct from the melanocytes. Common site are the buccal and the labial mucosa and the gingiva. Treatment: surgical excision is the treatment of choice for the oral lesion. Laser and intense pulse light therapies can be used and are successful for the treatment of the cutaneous nevi. Next is the malignant melanoma. It is a tumor that is produced by the malignant transformation of the melanocytes. So it is the least common but most deadly of all primary skin tumors. It occurs at a young age. It is more in families have the melanomas frequently exhibit mutations in the BRAF, HRAS, NRAS, and proto-oncogenes. Whites are more commonly involved. High mortality rate seen in black. Male prediction: the melanoma, it is the most common occurring in female of childbearing age. So what you will see: multifocal or diffuse pigmentation. Physiological pigmentation is the most common source of multifocal or diffuse oral pigmentation. Drug-induced melanosis. Medication may induce a variety of different forms of mucocutaneous pigmentation. The chief drugs that are involved in drug-induced melanosis, they can be anti-malarial drugs, including the chloroquine, hydroquinone, and other drugs. Smokers' melanosis. The amount of pigmentation that increases with the greater tobacco use. It is more common in the females. It occurs in the cigarette and pipe smokers. The oral melanosis increases first year of smoking and eventually it is reduced. Melasma is a common acquired symmetrical melanosis that develops on the sun-exposed area of the skin. So melasma occur on the sun-exposed area of the skin. Most commonly area affected are the forehead, cheeks, upper lips, and the chin. It is seen in the darker skinned individual. The melasma has been used to describe any form of general facial hyperpigmentation. Conditions in which melanosis is associated with the systemic or genetic disorder are Addison disease, Cushing syndrome, hyperthyroidism, primary biliary cirrhosis, vitamin B12 deficiency, Peutz-Jeghers syndrome, cafe au lait pigmentation, HIV-associated melanosis. Lozier-Hunziker pigmentation. It is the hyperpigmentation of the oral mucosa. So the bleeding into the skin can occur from the broken blood vessels that form tiny red dots that are known as petechiae. Blood can also collect under the tissue in the larger flat area. They are the purpuras, and a very large bruised areas are known as ecchymoses. The petechiae, they are small, red, non-blanching macular lesions that are caused by intradermal capillary bleeding, whereas the purpura, they are large, raved lesions resulting from bleeding within the skin. So what causes petechiae and ecchymoses? They are caused by the blood capillaries, which are small blood vessels, and they appear in the group. Like purpura, petechiae looks more like a rash and are usually the result of medication or underlying skin. So what does this petechiae and purpura indicates? Remember thrombotic thrombocytopenia purpura. It is a rare blood disorder that causes tiny blood clots to form throughout your body. So this can cause the tiny red or purple spots known as petechiae, and as well as the unexplained purplish bruising that can look like a rash. Hemochromatosis. Hemochromatosis, it is a chronic progressive disease that is characterized by excessive iron deposition in the liver and other organs and tissue. Exogenous pigmentation, that could be due to the outside source, that the source could be amalgam tattoo, graphite tattoo, ornamental tattoos, medicinal metal induced pigmentation, heavy metals pigmentation, drug induced pigmentation, or due to hairy tongue. The amalgam tattoo, they appears microscopically. The particles are typically aligned along the collagen fibers and around the blood vessels. The graphite tattoo that occurs on the palate one to the treatment due to the lead pencil, due to the treatment implantation of the lead pencils. Microscopically, they will resemble like amalgam. Metal induced pigmentation, a number of metallic compounds has been used medicinally for treatment of various systemic diseases. Heavy metals like lead, mercury, bismuth, arsenic has been shown to deposit in the oral tissue if they are ingested over extended period of the time. The drug induced pigmentation, that is the minocycline, which is a tetracycline derivative that is used in treatment of acne, that is a cause of drug induced non-melanin associated oral pigmentation. Hairy tongue, due to the hypertrophy of the filiform papillae or due to the keratin production. So that was all about the pigmentation.